from the Psych Hub Podcast Network.
And welcome to the Burnout Antidote, infusing well-being into the healthcare culture. I'm Paul Dager, and I'm joined by my co-host and good buddy here.
Hi, I'm Amy Pearlman.
And our topic for today is having a voice and expanding diversity of voices at the table in the healthcare system. That's a long title, but I think it really identifies a need.
I agree with you, Paul. And I think this one is a different conversation for us to have when people can't see us here. So
True.
As I look at Paul, I am seeing someone who is a white male of a certain age, which I will not disclose unless you want to.
There's gray in the beard. It's okay.
Easier to see than it is to hear, I think, in the conversations. And I am also white, a little younger than Paul, but not super young myself. And we both identify as, cisgender, heterosexual, white people. And to have white people have this conversation feels like we needed to say that right up front. We are owning what that privilege is, and also owning that as much as we are thinking this through on our journey and committed to doing it right, whatever right means, that many of these things we have been privileged enough not to experience or to experience from afar. And there are other parts of ourselves that are less seen, that are maybe more internal around age or around religion or around beliefs that may not come out in the same way. And I do want to acknowledge that we feel in the same way, but the privilege is not going unnoticed, and we didn't want it to go unsaid here. Is there anything you wanted to add to that, Paul?
No, I just beautifully put out there as far as we want to be transparent in who we are as we approach this topic.
Thank you. And I'd like to take some time to listen to someone's story who has a different background than us and what this was like for her in healthcare.
Let's do it.
Hi, my name is Juliana. I am a medical doctor. I am currently working in a university-affiliated hospital here in the U.S., and I am originally from Colombia, from Bogota. I did medical school back there, and then I immigrated and came to the U.S., and I would like to talk a little more about my experience and the experience of coming from a third world country and trying to make my way through an American system, having little resources and being in an unpaid position as a bridge of coming to do my medical training here in the US has been hard, because you have to depend on your parents, your family support, your savings from your past work, and navigating through a system where you come from a marginalized community, and that sometimes that's not seen here in the US. The Latin community, especially if they just come from their second generation or even first generation, but have been living here in the US for a long time, it's in a way easier than what some other people that come here for the first time, especially after growing up in another country and just trying to navigate being here. In my experience, has been a little hard trying to break through the cultural differences, getting to know how the American culture works. Has been a difficult experience, but it has been nice. So what I have learned being here and having this experience as a Latin doctor, as a Latin woman especially, of being able to meet with other patients and with other people that come from similar backgrounds as me, has been gratifying, because in a way I can be more empathic to them. I can understand them in a little more deep way that sometimes another physician or another healthcare provider cannot. And the language barrier, even though many people here are fluent, I am fluent in English, and we can all communicate in the same language. Sometimes just being able to speak with these patients in Spanish, understand the cultural manners in which they express and feel their disease has been really important to me and really has allowed me to feel important and valuable in this community. So even though I am far away from home, I am struggling to keep myself afloat here in the system. I know that patients and in the long term, people will be grateful of having me here and having my presence here. Speaking up sometimes as an alien physician or as an immigrant or just as a Latin woman isn't as easy, and you don't feel necessarily as powerful as you might feel back at home. And being able to support yourselves from your mentors and from my professors and my other coworkers has been important. And not feeling like I am alone and knowing that there are other immigrant people here and we can all support each other, especially between service that's really male focused and where there are very few women and very few physicians. It is hard to navigate, but being able to support myself with them and knowing that even though I might feel small at the beginning, knowing that I will have their support if I want to speak up, if I want to give my opinion, that has really given me, in a way, the strength that I sometimes feel I might lack.
Amy, I am so grateful for that doctor who shared her experience. And, there are some key elements that I heard. There was this acknowledgement of that in healthcare, and especially among fellow doctors, it is a male, I could probably even say a white male dominated culture, and how she feels at times that not fitting in with that or not recognized for her value. And I found it fascinating. And it almost comes back to our self-compassion, common humanity. She recognized building community is what she needed, and how she did that actually with patients who were from a marginalized population as well, and that she could and then speak in her native tongue. I thought was beautiful, because that there are times where that almost sounded healing, to be able to use her language of birth as a way to create and build that community.
I loved that example, one, because I'm also a big proponent of community, but it
Mm-hmm.
also spoke to me about really dismantling this divide between us and them,
Yeah.
between patients and healthcare clinicians, and
Mm-hmm.
thinking about our unique identities and really putting that at the forefront
Mm-hmm.
of intentionally including. I started to think some around how much data is out there in public health, in conversation around
Mm-hmm.
what communities and what races, ethnicities are, and genders are accessing services
Yeah.
or are hitting these outcomes for healthcare. But I read a lot less around how that is reflected in the population that serves them and what that is like
Yeah.
for the healthcare clinician's experience.
Well, yeah. Is that part of the access issue, where I'm not comfortable showing up because I don't see anyone like me delivering care? And th- that how something may unravel medically, that's just a tragedy. And so how do we have more representation of our communities in our healthcare organizations? To me, it's just necessity.
I think that ties us into the conversation we had around workplaces and how do you build a
Mm-hmm.
healthy workplace, and also the systemic racism that is
Mm-hmm.
out there around who has access to education, training programs, who sees
Right.
healthcare clinicians not just in receiving services from someone that looks like you, but what is your
Mm-hmm.
path professionally when you see yourself reflected in the clinicians you serve as well.
Yeah, and I feel like in some ways, organizations and leaders need to take up steps to make opportunities for more voices at the table. And we're also, that idea of coming back to the collective and the individual, and the the collective needs to move, but what can individuals do strikes me as something important to offer to begin that movement process.
I love that because this is an area, regardless of background, where people frequently feel stuck and
Yeah. Yeah.
don't know what to do themselves. And I have
Mm-hmm.
encouraged people to think through, what do you know about your own identity? What are the parts
Mm.
of you that feel the most important? What are the parts of you that people see and the
Yeah.
parts of you that people don't see? And how is that
Mm-hmm.
reflected around you? So, doing
Mm-hmm.
this internal work and almost an assessment of sorts of where am I at? Who am
Yeah.
I? How do people see me as separate than how do I feel as well?
Yeah.
Us healthcare clinicians are driven to heal and help others. At PsychHub, we offer a wide variety of content that can support your well-being, help you find new creative and evidence-based ways to practice, and get inspired again. Whether you want to better understand depression, or you're interested in providing trauma-informed care, or you want to learn about navigating grief, our vast library of educational content has you covered. PsychHub offers curated continuing education learning opportunities on a variety of timely and relevant mental health topics and evidence-based interventions, geared specifically toward healthcare and mental health providers. These custom learning programs will empower you to support better mental health for patients, colleagues, and yourself. Learn more about our evidence-based mental health education opportunities at psychhub.com.
Amy, I got an idea, and I love when these pop in my head and I roll with them. I'm going to channel my dear mother, who we lost last year, and she was a huge people watcher. She was always at the window checking out the neighborhood. And I'm wondering, what would it be like? And I want to come back to pausing and reflecting, this idea of being versus doing, to, whether it's in the hospital lobby or it's at the ice cream shop or it's, sitting on your front patio, and do some people watching. And to your point about becoming aware of how do we identify ourselves and others, what would it be like to, when you see someone going by, imagine a story about this person, and where do you just based upon appearance and behavior, what first stories come to mind, and then be willing to set those aside as you acknowledge the stories that come into your mind. And then let's take this a step further. Imagine they're looking back at you. What story do they tell about this person they saw staring at them, which sounds really wrong? Or what story would you want them to hear about you as a person? And I feel like this lends itself to the idea of common humanity, that the way we bring down the walls is first acknowledge how we put the walls up.
I love this, Paul, for so many reasons. One of them
Mm.
feels a little bit light considering the topic, but it reminds me a little bit of this public speaking advice that people frequently get, which is picture the audience in their underwear.
I thought you were going there.
I
Okay,
did. I started
help me bridge the gap on that.
So I started to think about, as you tell stories about yourself, or you tell stories about the
Yeah,
people around you, do you
yeah,
perceive people as being supportive of you, as being approachable, as being vulnerable in some way? And I guess the
yeah.
vulnerability is the underwear piece,
Okay, I'm with you. I
just to
got it.
tie it all
Okay.
together. Because I typically feel most comfortable when I take stock of what's going on around me and choose to believe that people are
Yeah.
there to support me.
Mm-hmm.
And that really is a privilege in itself,
Mm-hmm.
because it is not an experience that many people have.
I'm almost thinking back to our previous episode and this idea of making the norm of asking how somebody is doing. And I think sometimes we assume how someone is doing based upon outer appearance, and making the connection here around the empathy, fatigue, and compassion, and bringing voices to the table, exposing those assumptions that stop us, again, being and doing. We have so many threads running here that if I honor someone's being, that invites me to do in a way that takes down the walls and bridges the gap and invites more voices to the table.
I think that is also, just to tie it in together more, is that's what creates a healthy workplace, is this sense of freedom in asking the question when we see suffering or when it's a topic that's difficult to talk about, which sometimes diversity, equity, inclusion is something that people avoid when it makes them feel uncomfortable.
Yeah. And how do we make it okay to feel uncomfortable? Because that's life, right?
Right.
There's going to be times where we just got to make space for that too.
So I encourage this exercise in a different way, because there's a way to do it that works for each of us.
Yeah.
In examining the stories that we tell, the stories people tell about us, and a larger frame of reference with how those interactions go day to day. What does this, do we come in a place of vulnerability, or do we come from a place of power or privilege, or maybe it's all of the above in various situations?
Yeah. Amy, I hope we did right by this topic, and I hope we encouraged conversation.
I agree. It was a riskier one, so I felt like I could own the vulnerability in this, but also own the commitment to doing this right. And I hope that we continue the conversation on our next episode, where we talk about bias and discrimination in the workplace, which feels close to this as well.
Yeah, I think there's definitely a connection there. So let's continue the conversation with that focus next week.
Bye, Paul.
Thanks. Bye.
If you'd like to reach us, you can do so at podcast@psychhub.com. To be notified of new episodes, don't forget to like, subscribe, or follow wherever you're listening. And reviews are so helpful, so please do leave one if you can. It allows others to find us and to join along. The Burnout Antidote is executive produced and edited by Jacob Morrison. Research is assisted by Tekla Ross. Show artwork was created by Ornella Jangoli and Ashton Smith. A very special thanks to Juliana Castro, Alyssa Fackler, Trevin Stiegel, Andrea Womack, and of course, our pet, Pickles. The Burnout Antidote is a co-production from Psych Hub and is brought to you by Janssen Neuroscience.